We're talking about myofascial pain, and we are lucky to have an expert, Dr. Brian Wienk, who helps us with a contract out in South Dakota. He's a physical therapist. Brian, you did your undergrad at Augustana, I understand it. What was that degree in?
That was a Bachelor of Science in Biology.
Okay, he's a bio guy just like me. And then Brian moved on to get his master's in physical therapy at the University of South Dakota. Now that's the Coyotes, not to be confused with the Jackrabbits. That's SDSU, that's South Dakota State University, your hated rival. And then Brian did go on to earn his Doctor of Science from Texas Tech. I believe that's the Red Raiders down there. With Phil Sizer, I think, worked with him. One of my favorite CE instructors. And then Brian's also earned some designations through our professional organization, the American Physical Therapy Association. He has his OCS, which is a orthopedic designation, took some special tests to gain that. And he also has a certified orthopedic manual therapy through the Institute of, I get this one, it's the IAOM now, right? The International Academy of Orthopedic Medicine. And then Brian's also a instructor of orthopedics at Briar Cliff University. So he instructs physical therapy students. In addition, he also does some professional CE for physical therapists in the realm of soft tissue, instrument assisted soft tissue techniques. So he comes well qualified, and we're lucky to have him with TC Fit part-time, and we're lucky to have him today as well. So welcome, Brian. Is there anything that I missed with that robust CV of yours?
Thank you. I'm going to take you on the road with me, I think, if I have to present anything.
All right. Also, just another professional that we have here is Andrea Myers. Andrea also runs one of our contracts. She's a physical therapist, probably not as well versed in soft tissue, just like me, as Brian is, but she may pipe in here and ask some questions as well. So Brian, just out of the gates, I guess for those working from home and for others, who might be maybe active or trying to get active again, can you tell us a little bit about how soft tissue can adversely affect us and how pliable soft tissue can help us feel better and help us be orthopedically sound?
Right. Well, I think, one thing is that fascia, it's a connective tissue throughout our whole body. It's not just our muscles, but it also covers our blood vessels, our organs, our bones, our nerves. All those things have fascia related to that. So it's kind of like a saran wrap, and it kind of compartmentalizes all of these different structures. So it's everywhere. And when it's not working right, particularly with our muscles, we may develop tightness. Chronically, we might have pain related to that area. But a lot of times there'll be a decrease in movement and a feeling of tightness and or pain. Sometimes it's in one spot, sometimes it's somewhere else. So talk about that as well.
Okay, great. And so can you tell us, so fascia is like a connective tissue. So myofascia is like just the connective tissue that you described along with the muscles then?
Yeah, exactly. So it's going to cover the muscles. We also have tissue just right under our skin called superficial fascia. And that's going to be more important for like immunity and it's more loosely fit though. The connective tissue we're talking about, the myofascial, is more tightly organized, and it's going to cover all of our muscles. And you'll notice it more in certain areas. For example, if you want to feel a thick fascia, just feel your iliotibial band on the outside of your thigh and that tight cord there. That is all fascia. As well as in our back, we have a fascia that holds us together. And so flexibility is important, but it also provides a role of stability for our spine, for example. And that's important. Well.
Okay, great. So these myofascial restrictions, we'll call them, can cause orthopedic issues, or do they cause orthopedic issues, or are they secondary to maybe a joint or another orthopedic issue?
Yeah, I think it could go either way. I think a restriction in a joint could lead to muscle tightness that eventually might show up as myofascial tightness, tender points or trigger points. And secondly, those tightened areas can also create joint stiffness as well. And we have to think of this as a whole chain of fascia, not just one area too. So sometimes we have to treat a broader area when we treat these myofascial restrictions and not just focus on the painful spot.
Okay, that's good to know. You used a couple terms I think that a lot of people are familiar with, but might not understand really what they are. And that is, you talked about a trigger point or a tender point, AKA a knot. I have a knot in my muscle, Dr. Brian. So can you describe what a trigger point or a tender point is, and is it appropriate to call it a knot?
Right. Well, I think of a knot as more of a cramp, or a tightness you can almost see and feel. A trigger or a tender point is a point where if somebody pushes on it, it's tender in that spot. Whereas a trigger point is going to refer somewhere else. So I can press my thumb in someone's shoulder blade and they feel this pain going down the outside of their arm. That's more of a trigger point then. And depending on how active it is will determine if it's how chronic it is or how involved it may be.
Okay, so then is it appropriate to call it a knot? I mean, how do you determine where you're going to work when you have somebody in clinic, and how does one, if they want to work on these areas on their own at home, how do they determine where's a good spot?
Yeah, I think your body will tell you in terms of tenderness to find those tender points. You have to be a little more careful if you're hanging out on spots too long that are shooting down your arm or something, because you may be on a nerve or something beyond just a muscle point. We have blood vessels and nerves that run through our body as well. So I'd say the biggest way is just to look for tender points, either by feeling with your thumb, or if you want to find a lot of them at once, just roll yourself out on a foam roller and I didn't hurt at all until I did that, and then oh my gosh, I got all this. I had.
Yeah.
So.
And do you find that tissue? I mean, let's talk about this myofascial tissue a bit. Are there changes as we age, just with, as we move forward in our years? And let's face it, most of us here on this call are probably between the ages of 25 and 55, I'd imagine. What are we worried more about at 55 than we were at 25?
Yeah, I think tissue definitely changes. I think we lose water as we age, and I think these points tend to be more prevalent with people in their 30s, 40s than they are in their teens and 20s. I don't find as many tight bands of tissue in young folks as I do in people as they age. Plus, I think they can be more chronic, and this is where these really show up more in the chronic than the acute cases. Acute case, you'll have that local inflammation and then things will settle down. This case, you might just have one little tight band somewhere in the muscle tissue that needs to be worked on. So we try to find that and then work on it in the clinic, and then follow it up with stretching and other exercises as well to help promote that new that decreased pain and that new length that we established in the tissue.
Well, you're bringing up a nice segue, but before I move on with my next question, is there any question from the audience? Anybody? Just if you have any questions at all, Michelle, anything in the chat box at all?
No chat box yet, but Brian, I have a question for you, which is, do I always need to wait for pain, or what are some symptoms of tight fascia that maybe occur before I have pain?
Sure. Yeah, you wouldn't have to necessarily wait for pain. You might notice just a decrease in your flexibility or your movement as well as kind of an early sign or symptom that something might be going on. And then that just tells us what tissues maybe we need to look at more closely. But I would say if you see a change in maybe how you're walking or how you're lifting or how tight you feel when you do certain exercises, if you're doing a lat pull down, you feel it on one side, not the other, it might be a sign that there's something going on there that's restricting that movement. But it'll probably be more with flexibility that you'll notice that.
It's great. And just to let the audience know too, of course, Michelle Hodap's a soft tissue expert too. She's a massage therapist. So Michelle, I forgot to give you your kudo. Brian, so I know that you're a clinical physical therapist and you still treat in clinic, but also you teach students this. I guess when you see a patient in clinic or talk to your students, so what tools do you use in the clinic to help with this? And then conversely, what tools do you usually recommend that your patients use to help with these restrictions?
Sure. Yeah, those are great questions. In the clinic, I use a tool similar to this. Just looks like a fancy spatula or something, but what it has is it's ceramic on the inside, vinyl coated on the outside. And as I run this along the tissue, it'll actually vibrate. And when it vibrates, it tells me where the fascial restriction is. So before that, I would always have to use my thumbs and just kind of go across the fiber and find all these tight bands. With tools like these, I can cover a larger area, find multiple areas of restriction, and then treat them. If we're working on smaller areas, I might use a smaller tool for the hand, for example, versus a back or a limb. And so that would be something that I use in the clinic. I would say daily when I'm in the clinic, I'm using it on somebody. And I get really better lasting results with that. I dug my thumbs into people for years and heard a lot of people and they like, oh, that's the spot. But they come back the next time and they still had that same spot. And it was frustrating because you're trying to decrease that. And then you send them home a Theracane or something where they're able to push on their own, or maybe we use a tennis ball, those hard to reach places, or one of these lacrosse balls. And I use that myself sometimes because my family isn't very helpful. They don't help me when I hurt. I got to find ways to do it myself, just like
your wife won't rub your shoulders, Brian?
No, she's afraid of me. So she won't let me treat her either because she's like, I'll just get better. I've seen pictures of you do. I might use a stretch strap, something like this. I'm very inflexible, or I would just say tightly wound. I don't have a lot of pain associated with it, but I'm just a tight person. So I need to use a stretching strap to help assist me because I'm not flexible enough to do that. I would say something that's real popular right now is these vibrating devices, whether it's a vibrating foam roller, a vibrating ball, a vibrating gun that looks like a big hair dryer with a puncher on the end.
Yeah, don't you wish you would have come up with that Hypervolt or that Theragun? Those are the two brands that people hear about. But anyhow, I'll let you continue. I'm sorry.
$350, that's pretty good profit margin, I'm guessing.
I believe this. I agree.
But I do think that vibration has a component as well. I listened to a podcast recently by Mike Reinold, and they talked about these Theraguns and Myofascial Release. And what they find in the clinic, they use them quite a bit in their sports-related training. And they use it more for like a warm-up of the tissue before they do other stuff to try to improve mobility of the tissue. So I think all of these things, whether you're using a foam roller, using a ball, it's to try to prepare the tissue to be more flexible, to allow you to do the activities that you want to be able to do.
Okay, great. And we're just keeping a close eye on our time, Brian. Can you touch on also where you feel the low-hanging fruit is when it comes to your typical office worker, or how about this? How about any middle-aged person in our Western society here? Where do you find I know I evaluate this patient, what I'm going to find because of what they do? Are there muscles that just constantly become a little bit more involved because of our culture or because of our static positioning throughout the day?
Yeah,
that's
absolutely.
Everybody have knots or trigger points or tender points.
Yeah, that's a great question. And I would say, yes, everyone does have tender points. Not everyone has trigger points, though. So those tender points, we can consistently palpate or feel certain areas of people's shoulder blade area. And I can guarantee you, I can make them say, yeah, that's uncomfortable. And why don't you stop that? Or maybe they say, hey, why don't you keep. feels really good. So, meeting before, but one was through, so hopefully you couldn't hear that.
Okay, but we're good.
So I would say everyone has tender points. Not everybody has trigger points, and so I think that's just the nature of some of our tissue and where the nerves are, and what's closer to the surface versus deep. So.
Okay, great. So Michelle, do we have something in the chat box? I just see a little red. Maybe that's you putting stuff in.
Brian, we have a question from Bob, and he wants to know, before doing any foam rolling, are there specific warm-up exercises that are recommended?
That's a great question. I don't know of any. If it was me, I would, if I was going to roll my tissue, I would probably roll it after, like after I was warmed up and I've done some activity, kind of to try to get some of those waste products out of your system. I'm not sure what other people have done in the fitness world with that, but.
I typically tell my patients, Brian, the same thing, that I like warming up that tissue from the inside out. So sure, you can get into a hot tub or a hot shower if you want, but I prefer the activity for the exact reasons you said. You're kind of flushing out the waste products and kind of getting that muscle primed. And I think you're going to be more focused finding those trigger points then. Andrea or Michelle, do you guys have any comments on that?
Yeah, I mean, I think of sometimes people foam roll very quickly, and I view that almost as a little bit lighter pressure, more of a warm up. But the ideal, when I think of foam rolling as getting, loosening up that fascia, then it's probably after my body's already warm and a much slower pace, is my general recommendation. Andrea, do you have any thoughts?
No, I totally agree with that. I don't have anything to add there.
Yeah, I think the body's always going to accept those stretches and those foam rollers and those Theracanes and lacrosse balls better when the juices are flowing, when the muscle's warm and the blood flow's going in there. So we all concur, Brian. So thank you for setting that up.
You bet.
So, and then regarding back to our original question about the low-hanging fruit, are there areas that you typically see these trigger points, tender points, et cetera, that in certain areas of the body or certain specific muscles even?
Yeah, I think a lot of what I see in office workers or factory workers for that matter, there's a lot going on along the shoulder blades and the scapula. And, that's probably the most common area I see. The nice thing is that's an area that the doctors tend to not do anything for. Anything between our, down from our neck down to our low back, they kind of just ignore it, and people live with that for a long time. And there's so many structures there that can cause numbness into your hands and fingers and just cause people a lot of problems. Now, due to our posture, we tend to be more rounded shoulders, forward head in general. And so some of our structures in the front get tight too, our chest and our front of our shoulders, those kind of things. Right. So I don't say that I work on that as specifically with these techniques. I could, but I often will give some stretching for that area. But mostly where people complain of their pain is more on the backside in between the shoulder blades and that area. Now, if you're running a lot or working out, then we see more maybe in the calves, for example, can be areas where there's a lot of tenderness, or even the feet. If you're working with your hands, we might see stuff in the hands itself. Maybe have a start of some carpal tunnel going on, and so we want to try to treat that fascia that might be restricting the nerve as well. So there's a lot of areas that can have that depending on what you're doing, but mostly upper back area for me.
Okay, I want to ask one more question, Brian, and then I have a question from one of our attendees. Can you tell me about what, outside of the pain, we've been talking a lot about pain and lack of mobility, are there other things that happens to the muscle in a positive way with soft tissue and with a more mobile muscle physiologically?
Sure. Yeah, I'm not sure. I would just say that when it's not working right, people feel it, and when it is, you shouldn't feel anything with it. And so
Gotcha.
And chronically tight muscle is going to build up waste products within that muscle. And so we want to try to release that and get that out of there the best that we can. And I think there's a lot of techniques to do that. It's just finding out what works best for you. If you're not able to do it yourself, then I suggest you go to somebody who's familiar with these types of techniques. I've never taken a myofascial release course, but there's people they feel everything through their hands and they're doing these long, prolonged stretches. And I think a lot of people benefit from that, but it's not something I'm trained in. I more use a tool and get under there and find that instantly people feel more movement. And if you can gain that instantly, I think then it's just maintaining that and you get better results and they last longer.
Perfect. I appreciate that. All right. We have 2 questions here. One from Jackie. After sitting at my desk all day, what are some good foam roller exercises to do? Are there any preventative foam roller exercises? And I guess Brian, we'll let you answer first, and then we'll have Michelle or some of our other fitness professionals or Andrea can answer that as well. So.
Sure. Yeah, well, I would just suggest, we think about being stuck forward all day long. We're trying to undo that. So if you lay on that foam roller the lengthwise with your spine, with your tailbone on the bottom and your head at the top, and you can just kind of roll from side to side. And if you can try to tuck your chin when you do that and maybe pull your arms back and keep your stomach pulled in just to undo everything. And it really helps to get your body more in balance and more of a neutral alignment after a long day's work. So that would probably be my best suggestion.
Just kind of that goalpost exercise out there. Yep, opening things up. Right. That's great. I like that one too. And it feels good at the end of the day. We have another question here from Emily. Before we do that, any other options from our fitness team or our physical therapy team or massage team?
Matt, I did share in the chat box the foam rolling with the TC Fit team on YouTube. So there are some options there, including the kind of the stretch that Dr. Brian was talking about with that goalpost. That's one of my favorites at home.
Okay. And did those YouTube videos win some awards, Michelle, I think?
Correct. Yes.
Okay. All right. Well, we do have a question for Emily and Brian. Again, we'll let you address it. And then if other people have some input, we can listen to that as well. Emily asks, how can we address those upper back issues at home? And I think you did touch on one already with that goalpost stretch and the foam roller. Are there any other techniques, Brian, that might be helpful for that?
Yeah, I think for your upper back, you can even turn the foam roller the other way and go across your spine. Got to be a little careful with that if it's too firm of a foam roller or too uncomfortable, but you can roll your back out that way too, and that'll help promote some extension and movement of your upper back. I think we get a lot of stiffness when we sit still all the time. So another exercise I love to give is have people lay on their side and put one hand on top of the other and kind of roll forward and back. And when you do that, you're really getting some rotation through your upper back. So I think any movement activity that helps promote extension or rotation is going to help you in that upper to mid back where you feel tight. We didn't really talk about it, but I like activities like yoga, Tai Chi, Pilates. All these things are a movement. One's called Feldenkrais as well. And these are all movement type activities and exercise that usually involve some sort of deep breathing. And if we're having issues in our upper back as well, I think breathing is real important, and trying to breathe more from the diaphragm versus your upper chest is important for that. So,
and I think all those emphasize one thing that in the physical therapy world we emphasize a lot, and that's just simple maintenance of good posture. I think that all goes hand in hand with the breathing and everything else that you talked about. All right, we're winding down, and I want to get one more question in. And Michelle, I don't know if we can maybe get some links in there, or Mia can, when we post this, that some of these exercise examples potentially. But Laura Lee asks, I suffer from stiff heels after walking. Rolling my heels over a tennis ball provides temporary relief. Is there a better option for long-term repair? And she puts that in quotations.
Right. Yeah, I think, a couple things. One, our fascia that's underneath our foot, it's called our plantar fascia, is almost continuous with what goes behind the back of the leg. So our Achilles tendon and our calf muscles. So I think we need to incorporate calf stretching as well as what you're doing in the foot itself. And And if that combination isn't enough to get you relief, then you go see an expert or someone who has tools similar to these, or they might be metal, they might be plastic. A chain on the backside, combine that with your stretches. Unfortunately, the plantar fascia can be fairly chronic and take a while to resolve, but it typically does resolve over time. Some people try night splints with that as well. Some people try foot orthotics. There's all sorts of things, and not one thing works for everybody, or they'd be a millionaire. So,
You took my line, Brian.
oh, sorry.
That's what I tell people as well. So we're winding down to our time limit. We know people need to get to other meetings or have lunch or whatever the case may be. I really want to thank Dr. Brian Wienk for taking the time today, all the way from South Dakota, to be with us. He is a true expert in soft tissue and physical therapy. So thank you. Thank you for everybody else for attending. If there are things that come up and questions, please feel free to email us in the fitness center. If we can't answer, we have ways of maybe asking, getting Brian these questions as well. And he, I'm sure, would be happy to help us answer those questions if we can. So I appreciate everybody's kind attention. Brian, again, thank you for taking the time. Andrea, thanks for being here as well again. It's always a pleasure. And hope everybody has a great rest of the week.
All right.